And there you see the jugular foramen. I've put the pipe cleaners back in the foramen. Now we're looking at from the inside, so the green pipe cleaner is coming through the jugular foramen. It therefore represents the internal jugular vein. And the pink pipe cleaner is coming through the carotid canal. It therefore represents the internal carotid artery. Surface feature associated with the temporal bone is the internal auditory meatus or internal auditory canal. The auditory nerve exits the petrous portion of the temporal bone through this opening. Now the petrous portion is this ridge right along here of the temporal bone. The suture associated with the temporal bone is the squamosal suture. Now I've turned the skull over to look at the final surface feature on the temporal bone, the styloid processes. The styloid processes look kind of like fangs. Styloid process here and here. The styloid processes anchor the hyoid bone. The hyoid bone looks like this, and it aids in swallowing. The hyoid bone is anchored to the styloid processes via the stylohyoid ligaments. Looking at the temporal bone laterally again, now we're going to look at the surface features on a disarticulated bone. So this is the disarticulated temporal bone, and I'm holding the zygomatic process. The surface features on this disarticulated bone are as follows. This is the mastoid process, the squamous portion. If we rotate the bone, this is the petrous portion, the ridge that we saw earlier on the inside. This opening is the external auditory meatus. This is the mandibular fossa for articulation with the mandibular condyle to form the temporomandibular joint. The jugular foramen cannot be seen in this view because the jugular foramen is actually between the temporal bone and the occipital bone. However, the carotid canal can be seen. Inferior view of the disarticulated temporal bone, and the pink pipe cleaner passes through the carotid canal, representing the internal carotid artery. Now looking more as it would appear from the inside, inner surface of the squamous portion, internal carotid artery coming out through the carotid canal. You might recognize that. That's the internal auditory meatus. Finally, this structure right here is the styloid process. Next, we're going to look at the occipital bone, which is this bone right here. Surface features of the occipital bone include the occipital condyles. The occipital condyles articulate with the superior articulating surfaces of the first cervical vertebra, known as C1, or also known as the atlas. This articulation between the occipital condyles of the occipital bone and the superior articulating surfaces of the atlas form the atlanto-occipital joint. If you will move your head in the direction that you move it when you say the word yes without actually using words, just head movement, that is the action of the atlanto-occipital joint. The large hole here is called the foramen magnum. Foramen magnum is the passageway for the brain stem as it leaves the skull. The jugular foramen is associated with the occipital bone as well as the temporal bone because it is within the suture between those bones. So here again, indicated with the green pipe cleaner, is the jugular foramen. This is from the outside. This shows the jugular foramen from the inside. Get your bearings. That's the petrous portion of the temporal bone, internal auditory meatus, jugular foramen, foramen magnum. Next we have the sphenoid bone. In the articulated skull, it's in this area. And I've placed a disarticulated sphenoid bone back here. The body of the sphenoid bone is this area. try to imagine that the sphenoid bone looks like a bird, and the bird has feet, which are the pterygoid processes, and the bird has two sets of wings, greater wings and lesser wings. Well, the part of the bird that the wings and the feet are attached to is the body, which again is this general area in here. The superior aspect of the body right here is the sella turcica of the sphenoid bone. That's where the pituitary gland sits. In the articulated skull, this is the sella turcica. These are lesser wings, and the greater wings wrap up this way. Interestingly, if we rotate the skull, look at a lateral view of the skull, this is the external surface of the greater wing of the sphenoid bone. Literally, this is the same structure as this. Things that I'm indicating now with the black wires are the optic foramen. The optic foramen are the passageways for the optic nerves. We can also see these passages by looking in the orbital fossa, which just means eyeball socket. The optic nerve is the sensory nerve that conducts impulses from the eye to the brain. Here I've indicated the optic foramen with the purple pipe cleaners and the disarticulated bone. Notice that the optic nerves would cross right over the sella turcica. That is the way the optic nerves cross, and the reason for that is to send signals from each eye to both sides of the brain. This is what gives you stereoscopic or three-dimensional vision. The openings in the sphenoid bone are the slits between the lesser and greater wings. I believe you can see the one on the left there quite well. Oh, there's the one on the right. Actually looks better, doesn't it? From the anterior aspect at the superior orbital fissure, and you see that little hole just above, that's the optic foramen we saw a moment ago. If you think about how complex the eye is, you can appreciate why there would be so many nerves associated with the eye. Again, you see right here the little hole, optic foramen, passageway for the optic nerve as well as the ophthalmic artery, and then the slit right here, the superior orbital fissure. The superior orbital fissure is the passageway for the oculomotor nerve, that's cranial nerve number 3, the trochlear nerve, which is cranial nerve number 4, the ophthalmic branch of the trigeminal nerve. Now, the trigeminal nerve is cranial nerve number 5, and it has 3 branches. Trigeminal has an ophthalmic branch, a mandibular branch, and a maxillary branch, but it's the ophthalmic branch that is one of 4 nerves passing through the superior orbital fissure. The abducens nerve, or cranial nerve number 6, is the 4th nerve to pass through the superior orbital fissure. For disarticulated sphenoid bone, now this is an anterior view. You can see the superior orbital fissure there indicated with the purple pipe cleaner. And you can see the right side, which is your left as you look at the screen. That is not indicated with a pipe cleaner. Now we're looking at the foramen rotundum from inside the cranial vault. I'm indicating the foramen rotundum with the pink pipe cleaner. Here in the disarticulated sphenoid bone, I'm indicating the foramen rotundum with a purple pipe cleaner. This is the other foramen rotundum, the foramen rotundum on the right. Foramen rotundum is the passageway for the maxillary branch of the trigeminal nerve. Next is the foramen ovale, indicated with the pink pipe cleaner in the articulated skull, and the purple pipe cleaner in the disarticulated skull. Let's try to put some of this together now. Again, we've got the foramen ovale indicated here with the purple pipe cleaner. This is the foramen rotundum. Again, rotundum is the passageway for the maxillary branch of the trigeminal nerve. ovale is the passageway for the mandibular branch of the trigeminal nerve. Also, we have this small hole, the foramen spinosum, which is the passageway for the meningeal vessels. In our skull, this is the foramen rotundum, this is the foramen ovale, this is the foramen spinosum. Next we have the foramen lacerum, which is right here. A lacerum is the passageway for the pharyngeal artery as well as the internal carotid artery. Now that's confusing because we've already said that the internal carotid artery passes through the carotid canal, and it does. But the carotid canal sort of bisects the foramen lacerum. Let me try to indicate all of that with pipe cleaners. Okay, now the foramen lacerum, I'll show it to you on the right first of all, is right there. Now on the left you see a purple pipe cleaner and a pink pipe cleaner. One representing the internal carotid artery, that would be the pink one, and the purple one representing the pharyngeal artery. And it looks like that they both come through the same hole. But when we turn the skull over and we look from the bottom, we can see that they are clearly two separate holes, two separate openings. So the purple pipe cleaner, the pharyngeal artery, goes straight through lacerum, while the pink pipe cleaner, the internal carotid artery, goes through the carotid canal, which travels this distance horizontally and then bisects the foramen lacerum. These are the pterygoid processes of the sphenoid bone, divided into lateral and medial plates. Again, lateral and medial plates. Exactly what we'd have to do to find those pterygoid processes on the disarticulated bone. So there's our bird with the wings and the feet. Well, the wings are the pterygoid processes. This is an anterior view of the disarticulated bone. Lateral, medial plate. Medial, lateral plate. If I turn the bone around, again, the pterygoid processes. The sphenoid sinus is within the body. Remember that the body is the part of the bone that the wings and the feet are attached to. Well, you can see openings into the sinuses here and here. Just remember, though, the body is hollow. Also remember that the superior aspect of the body is the sella turcica. Our next bone is the ethmoid bone. The ethmoid bone sits right here.